Good day and welcome everyone. My name is Erik Berg. I'm the present chairman of Habitat Norway and will be the moderator of today's webinar on World Habitat Day, brought to you directly from Oslo. We really look forward to having you with us in an interactive exercise where we hope that you all will contribute either on chat or on email. The whole event is meant to be collated in a written report from this webinar. But I must say that the event is a technological challenge, I can assure you. And please bear with me and us regarding the problems that certainly we will be facing. I'm a little bit assured that we have a former Norwegian Minister of Digitalization with us, that we might be seeking his advice. There also are some changes in the program and in its time schedule that we will revert to as we go. Regrettably, Professor Stiglitz has sent his apologies and will not be able to take part this afternoon. But we hope for his contributions at later webinars from Oslo. Before I pass on the microphone to Johannes Fjoseberg, in charge of technical arrangements, to explain its intricacies and how you optimally could benefit from this event, let me just say a few words about the context of this Habitat Day webinar. First, I would like to congratulate UN Habitat for having initiated and produced the report that forms the basis for today's deliberations. The report titled "The Future State of Cities in a World with Pandemics" represents a unique opportunity to pose questions on the new realities for cities and their populations after COVID-19. Now, this webinar, with more than 700 participants and speakers from all continents, also gives you a chance to listen, to learn, and also to initiate a small dialogue on the way forward, on how each of us, individually or together, can impact our respective authorities, be they local, national, or international. So please, participants, use the chat or email system actively. Thus again, on behalf of Habitat Norway, which we love to call the smallest of all important urban associations, I welcome you once again. You could, in fact, make Habitat Norway bigger by becoming a member on our homepage, www.habitat-norge.org. Then, over to Johannes for the technical details.
Hello, internet viewers. My task here is not very big. I would like to urge you to ask questions and comment the keynote speaker and the speakers after that as well. You can do that on using an email, habitatnorway@gmail.com. You can also use the direct messages on Facebook, our Facebook group. You'll find us in Habitat Norway on Facebook. And you can, of course, also leave a message, question, comments on YouTube if you are connected with a Gmail user. And these three ways, you can ask questions to us, and we'll comment that in the Q&A sessions after each speaker. And it will not be possible to ask questions and comment our guest speakers in the beginning. So with that, I'll leave the word back to Erik.
Thank you, Johannes. It has become a tradition for Habitat Norway to start our webinars with music, which is a true universal language. And this reflects the fact that the majority of our members are students. They have formed a band and named themselves Pøbel. Directly translated into English, it means the mob. The leader of the band is not Sergeant Pepper, but it is Eilert, who also is a member of Habitat Norway's executive board. The floor is yours, Eilert, and the mob.
Morgen gryr over dyr og trær med lyst og drift. Blomstene bøyes hinanden så nær i vindens vift. Av all denne duft, denne farve og klang, stiger med solen den gamle sang. Jeg elsker deg, elskede dagen. Timian, kløver og balder brå, lyst fiol. Dufter blant gullsko og klokker blå i middagssol. Bien som bor i en blomstermunn smil, synger en sang i den gamle stil. Jeg elsker deg, elskling i middagsfil. Der lyser mot natten en deilig hvit krysantemum. Nattsvermeren flyver kan hende dit, homosum. Jeg glemmer i blomster en sorg som jeg har hatt, men sverger i blomster og kjærlighet at jeg elsker deg. Jeg glemmer i blomster en sorg som jeg har hatt, men sverger i blomster og kjærlighet at jeg elsker deg, elskede dag og natt. Thank you to all those present in this room and to all those watching. I think it's quite telling for the current situation and to and as to how this pandemic and this crisis has altered the ways we think about and relate to cities. That we are currently, I think, 700 registered for this seminar online, and perhaps about close to 10 people physically present in this room in the center of Oslo. I certainly acknowledge that the challenges this pandemic showcases are all the more aggravating and difficult in developing countries, and I hope to hear from the different speakers as to how we can move forward in new ways of imagining cities facing this crisis. So with that, we are Pøbel, and if you enjoy what you hear, you can find us on social media, and we are going to play one more song for you. This is Karikatur.
Jeg besøkte diskoteket som jeg besøkte biblioteket en gang. Kastet meg over kvinner som jeg kastet meg over bøker en gang. Men for ordet var for langt. Mitt engasjement sabotertes. Jeg ble en karikatur av meg selv. Jeg ble en karikatur av meg selv. Jeg ble en karikatur av meg selv. Jeg ble en karikatur. Fremmede ble bekjente, og bekjente ble fremmede for meg. Mens fremmede ville kjenne meg, ville bekjente ikke lenger kjennes av meg. Min skygge forlot meg. En skikkelse nedfalt seg over meg. Jeg ble en karikatur av meg selv. Jeg ble en karikatur av meg selv. Jeg ble en karikatur av meg selv. Jeg ble en karikatur.
Tusen takk for oss.
Thank you very much, Pøbel, or the mob. I hope you all enjoyed the music. We can only regret that Norwegian is not a world language, but still, I hope you enjoyed the performance. So after this introduction, we will move into the opening and welcome session proper. Please be aware that there are some changes in the program, which we will come back to as we go. I'm pleased now to invite to the rostrum Anna Skibevåg. She is an architect of education, has worked with UN Habitat as a junior professional officer for several years, and is also member of Habitat Norway's executive board. Presently employed by the municipality of Oslo. Welcome to the rostrum, Anna.
Thank you, Eric, and thank you again to Pøbel for the nice music. It's a long time since I joined a concert, actually, I realized. So, Excellencies, ministers, ladies and gentlemen, it is a great honor and pleasure to welcome participants and speakers from all corners of the world to the first Habitat Day in the SDG Action Decade towards 2030. Habitat Norway is particularly pleased to welcome Deputy Executive Director Victor Kisob, who is with us from Nairobi. We can see. Hello. We appreciate very much the participation of Norwegian Minister of Local Government and Modernization, Mr. Nikolai Astrup, who has left today's busy parliamentary deliberations to join us here in the studio very soon. We would like to thank both of you for a consistent and unwavering support to the implementation of the SDGs and Agenda 2030. Also, a vote of thanks to the Polytechnical Association of Norway, who is providing technical support for a webinar with speakers on 3 continents and participants from 5 continents. The first World Habitat Day was celebrated in Nairobi in 1986. Shelter is my right was the theme. 35 years later, a broader rights-based approach is promoted. The right to the city for all is today's main urban mantra. In a situation with populist, nationalist, and authoritarian regimes in the offensive all over the world, a broad, holistic rights-based approach is more important than ever. The World Habitat Day, celebrated on the first Monday of October each year, is intended to remind the world that everyone has the power and the responsibility to shape the future of towns and cities. I hope this event would contribute to that end. The background of this event is as follows. In experiencing the social and economic shock of COVID-19 comes the realization that we must adapt new and better ways to deal with global crises. The pandemic has exposed and increased stark social and economic inequalities and system weaknesses. It has highlighted that long-term complex challenges and short-term crises demand new responses and ways of working. We hope to identify some of them during the course of this event. Suddenly, we are all developing countries in the same boat with WikiLeaks. As we look ahead, the question arises, what can we learn from the pandemic? What do we need to do differently? What kind of collaboration and action are needed to achieve transformative change and prepare for a radically different world? Cities containing 90% of all COVID cases will, because of demographic and economic development, be at the center. Social urban development has, however, during the 6 decades of the so-called development era, been utterly neglected by national and international governments all over the world. From 1970 to 2015, only 4% of total official development assistance was received for social purposes. In a situation with 1.8 billion people living in inadequate housing and 1 billion in slums, very few development agencies are promoting social housing programs. National governments focusing on the continuum between the most rural and the most urban need to utilize the opportunities and challenges that urban and regional development represents. The global context of today is one of evolving multiple crises, of which the pandemic is one, and the climate the most serious. Drawing on lessons learned from capacity building, advocacy, and grassroots action, the challenge becomes how we can catalyze, plan, and implement a different and better future. We are now just experiencing the first wave of what might come. It should be a memento for all. Habitat Norway would like to commend UN Habitat for, at an early stage of the pandemic, having initiated a new and thought-provoking flagship report titled The State of World Cities in Global Pandemics. We all look forward to today's presentation of its main findings and recommendations, as well as the expert interventions that follows on issues of health, housing, human rights, and the future of the global humanitarian system, reflecting the need for a broad, systematic approach to the multiple crises we are facing all over the world. They all tend to convene in cities and towns. Thank you for your attention.
Thank you very much, Anna, for sharing your wisdoms with us. We really appreciate your analysis and your underscoring that building forward is crucial in the time to come. I would now like to welcome the Deputy Executive Director of UN Habitat, Mr. Victor Kisob, to address us from Nairobi. The Executive Director, Mrs. Sharif, who was supposed to speak, has regrettably been prevented because of change in program in the Habitat Day celebrations in Surabaya, Indonesia. A few words about Mr. Kisob. He was appointed Deputy Executive Director in July 2018. He brings to the position more than 20 years of service in human resources management, spanning international affairs, policy, strategy operations, knowledge management, and partnerships, coupled with comprehensive background in the field, within the UN systems in Somalia, Israel, Palestine, Zambia, and Ethiopia. He holds a Master of Arts in Development Banking from the American University in Washington, D.C. So, Victor, again, welcome. The floor is yours.
Well, thank you very much. Excellencies, colleagues, friends, ladies and gentlemen. What a world we live in. A week ago, we reached an agonizing milestone of 1 million COVID-19 deaths, as the UN Secretary General put it. The world won't be the same after this pandemic. It is predicted that the way we will interact, work, play, and rest will drastically change. The instruments to overcome this crisis will also change. The status quo we knew is gone, and a new reality is in place. This new reality has compelled us to adopt new habits and unfamiliar choices for our communities and cities around the world. We have witnessed the fragility of our communities and our cities. We have observed even more glaringly the inequalities and unevenness of resource allocation for sustainable development. Although the possible outcome scenarios are self-evident to some, the scope of these impacts that we are going to access as we see how COVID takes over all of our societies is that it is clear to us right now that the job markets, the economy at large, and the use of social and physical space have been negatively affected, creating a world of uncertainty that for a rapid assessment and adaptation. The pandemic is a local and global crisis. Urban areas have become the epicenter of the pandemic. And as our Secretary General has indicated in his policy brief on COVID-19 in an urban world, for which UN Habitat was the penholder. Cities, particularly large agglomerations, played a role in the initial spread of the infection. However, we are also part of the solution. We, those dwellers of cities, facilitating a response to the pandemic. We can be extremely important providing solutions to rural settings. Cities are at the front line of this crisis, and they would continue to be in the future when medium-term and long-term responses will be implemented. The pandemic is teaching us important lessons. First of all, health and epidemiological studies reveal to us a sort of hidden truth. No country is fully prepared for epidemics or pandemics, and every country has important gaps to address in this regard. Secondly, governments were unprepared to respond to this crisis, particularly those with reduced funding for education, health, public facilities and institutions, basic services, and essential subsidies. These governments will be compelled to come back to the drawing board of the central and local governments dialogue and state and society relations. Thirdly, private sector and markets alone cannot respond to the crisis, and global supply chains are far from resilient. COVID-19 has disrupted the global economy. Demand, supply, and finance have been deeply affected. Trade and value chains have been disrupted. The propensity to consume will decrease and global FDIs will collapse, including a reversal in international investment in emerging markets. As a consequence, the number of unemployed people are growing in unprecedented manner. Poverty and inequality are increasing. Mortality of women and children will increase. GDP will be drastically reduced, and education is being interrupted. In short, the realization of the SDGs is seriously affected. We need to do everything possible to reverse this situation. At the end of this month, during the celebrations of World Cities Day, UN Habitat will launch the World Cities Report 2020 on the value of urbanization. This report makes the case for cities to remain central in the pursuit of sustainability, especially in these difficult times. The report also highlights that the new urban agenda and SDGs are both timely and relevant to fundamentally reform planning, policies, strategies, and budgets for cities to create value. This value touches on the economic, the social, the environmental, and intangible conditions. It touches on governance, political, cultural, and civic perceptions, and outcomes that are needed to improve quality of life of residents in tangible ways. Understanding the value of urbanization, advocating for new health habits, to managing appropriate responses is part of our strategy for the new normal. When putting in place medium-term and long-term responses, it is important to reflect on the nature and effectiveness of the systems of governance, not just to address health conditions, but more broadly, the governance of a more complex society. We have spent some time reflecting on what kind of social contract 21st century states would need, and how would local authorities be factored in. Effective recovery systems and possible new pandemic responses require a whole of government and whole of society approach, with the resources and clear collaborative mechanisms and capacities. At the outset of this pandemic, UN Habitat has been supporting several communities, cities, and countries. We have been working with local authorities and citizens for essential services. We have been assisting with developing disaster management plans and strengthening crisis management and response. There are particularly important aspects of this that comes in when you look at the informal sector, where communities are most at risk of high infection rates due to overcrowding, lack of basic services, and medical facilities. Beyond immediate actions and containment policies, we are gearing up for medium-term and long-term intervention. Our State of the World Cities report, Living with Pandemics, will be most timely. The proposed report serves as both an important study of COVID-19 response from an urban perspective and enables the international community to formulate concrete solutions. Mr. Eduardo Moreno, our Chief of the Knowledge and Innovation Branch, will deliver a keynote address on the initial findings of the report. And if I may, ladies and gentlemen, I would like to highlight the significant role that the government of Norway is playing in support of multilateral systems. I would like to thank Habitat Norway and the Ministry of Modernization and Local Government for their timely and generous support to the organization of this event and the active role that the ministry is playing in policy dialogue on human settlement. The COVID-19 pandemic gives us the unique opportunity to reimagine the city. I look forward to an engaging dialogue on COVID-19 in cities, in particular in the promotion of sustainable solutions and transformative ideas. It is our hope that we can continue forging a creative alliance towards sustainable, less polluting and less resource-consuming activities with a strong emphasis on human security and well-being. Ladies and gentlemen, thank you very much for your attention.
Thank you very much for your words of welcome, Victor. We would really like to commend you for having, since you started back in 2018, to have contributed to a new and much improved governance structure of UN Habitat with a clear division of responsibilities. We think that the new strategic plan 2020 to 2033 is another impressive result of your efforts. And we trust that this plan will be amended to meet the challenges of the ongoing pandemic, but also of the other parallel multiple crises that we see emerging. UN Habitat's vision of a better quality of life for all in an urbanizing world is certainly a bold and ambitious one. And as a small organization, a civil society organization, I could only indicate that you have our full support in your work, and that we hope also to strengthen the partnership with other Norwegian civil society organizations, with business corporations, but first of all, with the Ministry of Local Government and the Ministry of Foreign Affairs. So, then I'm honored to invite the Norwegian Minister of Local Government and Modernization, Mr. Nikolai Astrup, to welcome participants and inaugurate this Habitat Day event. Despite his relatively young age, he has an a very impressive political career. He is presently Minister of Local Government and Modernization. Formerly, he was Minister of Digitalization. You might need your advice later in the meeting. And he has also been former Minister of International Development Cooperation. He has been a member of Parliament for the Conservative Party from 2009 to 2018, and has a Master in Political Science from London School of Economics. He has work experience with the World Health Organization. Welcome to the rostrum, Mr. Astrup.
Excellencies, ladies and gentlemen, friends and colleagues, it's a great honor to be part of this webinar and to invite more than 500 participants from all corners of the world to join us. I'm particularly pleased to greet Deputy Executive Director of UN Habitat, Mr. Victor Kisob. I appreciate your and the UN Habitat's consistent and unwavering support for the implementation of Agenda 2030 and the Sustainable Development Goals. A vote of thanks to Habitat Norway for having initiated this Habitat Day webinar on cities and global pandemics. We hope to continue the partnership through future Habitat Days, Urban October campaigns and other events and processes related particularly to SDG 11, the city goal, and new urban agenda. I would also like to commend UN Habitat for having initiated a new and thought-provoking flagship report titled The State of World Cities in Global Pandemics, already early in the pandemic. I look forward to today's presentation of the report's main findings and recommendations, as well as the subsequent expert interventions on issues of health, housing, human rights, and the future of the global humanitarian system. This year's Habitat Day theme, Housing for All, a better urban future, reflects a main priority in my portfolio as Minister of Housing. It's also a central part of achieving the SDGs. Housing is explicitly articulated in SDG 11, and it's a key component of sustainable development across all the goals. Good housing drives access to basic services, contributes towards inclusive growth, and supports the development of a sustainable future, with a direct impact on the factors that contribute or mediate the effects of climate change. Investment in affordable housing will therefore have a profound and direct impact on many of the SDGs. However, we have now only 10 years left to achieve the SDGs. Therefore, the 2020s must be a decade of action. The government is now working on a national action plan for the SDGs. Our main goal is to make Norway more sustainable by translating the SDGs into relevant actions for Norway. I hold goal number 17 as my favorite, because the SDGs are so inevitably tied together. The goals cannot be solved one by one. We need strong partnerships. Achieving the ambitious targets of the 2030 Agenda requires innovative partnerships that bring together the public sector, civil society, the private sector, and academia. The action plan will therefore be developed in a broad process, and I hope many will provide input and share their experiences. The International Habitat Day is intended to remind the world that everyone has the power and the responsibility to shape the future of towns and cities. We need to work together to promote inclusive, safe, resilient, and sustainable cities. And I hope this event will contribute to that. Thank you for your attention.
Thank you very much, Mr. Minister, for your constructive and forward-looking comments. We are particularly pleased to note your initiatives regarding the production of the Norwegian Action Plan on the Sustainable Development Goals that you are in charge of in the Cabinet. What we see as very positive is the participatory or almost bottom-up approach that you have promoted and designed for civil society and other stakeholders. And Habitat Norway very much look forward to being part of your public inspill or contribution process. I would also like to take this opportunity to thank you and your ministry for the financial support to the Habitat Day and to the subsequent Urban October events that will take place in Trondheim, Tromsø, Stavanger, Kristiansand, and Oslo. Thank you very much for coming. Then I see an old colleague and friend on the screen. We are now proceeding to the central part of this event, the keynote speech titled The State of World Cities in Global Pandemics, Status, Challenges and Responses for More Resilient and Inclusive Cities. I kindly request that participants during this intervention prepare and forward questions and comments either during or immediately after the intervention. We have set aside 10 minutes for questions and answers, but there will also be a 15 minutes pause before the question and answer session, just to give you some time to consider and think out questions that are difficult to respond to. The central person in the compilation of the report, The State of World Cities in Global Pandemics, but also in the production of a number of previous State of the World reports, is Eduardo Lopez Moreno. He is presently Chief of the Knowledge and Innovation Branch of UN Habitat. And he is also Interim Director of the Mexican and Cuba country offices. So he is with us from Mexico City. Mr. Moreno has more than 25 years of academic and professional experience in housing and urban development policies, institutional analysis, global monitoring, equity, and urban poverty issues. He holds a PhD in urban geography and a master's in urban sociology from Sorbonne. Mr. Moreno is also a world-known photographer, winner of international awards with several international exhibitions. And you can find some of his photos in an exhibition that was produced by Habitat Norway a few years ago. I'm very pleased to welcome you, Eduardo. The floor is yours. Please, you can start.
Thank you very much. Can you hear me, Eric and people?
Yes, we can.
Thank you. It's a great honor to be here. Let me start right now. Sorry, it's a great honor to be here with you. Several of the previous speakers mentioned that COVID is a global urban crisis. It's interesting to notice that only with 56% of the population living in urban areas, we have almost all cases registered up to the day the Secretary General issued this important report, mentioning that urban areas were the place where COVID was taking place. This is happening because of the connectivity, international linkages, and perhaps some forms of proximity and some forms of density, which we are going to explain. However, it's important to say that in the report that we are preparing and some of the findings that I'm presenting, we did a study on which cities were infected first in terms of incidence of COVID and how this was moving to other places. We can notice that in a second and a third outbreak, it is very clear that COVID will move to small cities and rural areas. However, when that happens, cities will be prepared to respond in terms of territorial understanding that regional planning, the intermediation of cities, different form of looking at the connectivity of cities is the response to this pandemic. We need to understand which cities will play a new role in the future in this. Just to recall you that the last report of the Millennium Development Goals in 2015 said that 700 million people were lifted out of poverty, but more than 550 million through urban-based activity. When COVID will move to rural areas or small cities, still it will be an urban response. And this is an important element to consider. We are now in a new normal, but it's important to recognize that the old normal was not tired. The old normal was the culprit of what is happening. Bleak social context, rampant corruption, rising poverty, escalating inequality, a planet that is burning, political division. All this is what exacerbated the situation, spread the virus, and created this infection. This was accelerated by unsustainable forms of urbanization, biodiversity loss, climate change, and increased human and wildlife contact. We are broadening the interface of human and wildlife contact, increasing the chances of this infection disease. Air quality, when we analyze air quality, we understand that the long exposure to emission, and today more than 90% of cities in the world are affected by different forms of air quality, are weakening the immune system. They are making it harder to fight coronavirus. It's not only a morbidity burden. It's not that the pre-existing diseases are affecting people. Obviously, this has to do with worse health conditions, complex clinical management, and increased health costs. The reasons of this problem are to large extent connected to the regulation, liberalization, forms of privatization, and neoliberalism. This has led to incredible urban and territorial inequalities. In the last 20 years, 75% of cities in the world grew more unequal than they were 20 years ago. It has to do with the privatization of education and health, the reduction of funds for social services and for subsidies. COVID-19 is exposing a world of contradiction. On one side, poverty and exclusion, in the other, a world of abundance. In one side, a system of fragility, insecurity, and the other, a currently stable economy. Unprecedented progress in technology, but at the same time, difficulty to get essential goods and conditions, just to wear a mask, just to have a ventilator. We know today that markets cannot solve the problem. We know today that this crisis has shown some vegetative state contradictions, domestic violence in cities, affecting disproportionately women, distorted notions of digital intimacy and physical social distancing. Nations that are close when they should be interconnected, as we were expecting for many years. Cities are a sort of pharmacon, as Plato mentioned. In cities reside both the remedy and the virus. Cities are the best and the worst of society, but if we take them well, we will understand that it's in cities that we can prepare the best responses. The State of the World City Report, Living with Pandemic, analyzed 4 interconnected elements. We rethink the role of the state and the governance mechanisms. We analyze the normative work associated to responses and to long-term recovery. We look at a deep analysis of structural inequalities, both people and places. We rethink the city in terms of forms and functionality, and we look at the urban economy model in terms of how it is operating today. Before I go to these 4 things, let me tell you some initial considerations. Number 1, urban conditions and trends are not going to change if there are not societal change. I wrote in one book some years ago that slum dwellers were living in a future that was under construction. Today, all humanity is living in a future under construction. We need to understand that our world today is in pieces, a very political discourse. Trust between countries, between people, between governments and people is to some extent undermined. Societies tend to be radicalized. And the consensus that was an ideal mechanism to consolidate leadership is taking a back seat. All this is important because only in the last months, more than 3.5 billion people were told, were asked, or were ordered to stay at home. And this requires better forms of coordination. We understood with this crisis that the global interdependence that we have is not based in solidarity, but in convenience. We need to understand very fast what is changing, how we can adapt, as our Deputy Executive Director mentioned, which are the behavior and the practices that we need to adapt. We need to rethink the notion of proximity and cities. On one hand, to understand that global markets are not resilient as we thought, and some form of autarky production is needed. We need to rediscover that proximity offers new opportunities and objective opportunities to increase not mobility, but accessibility. We need to rethink public space, planning and urban development. And as also our Deputy Executive Director mentioned, global agendas have been seriously affected. However, global agendas are the best way that we have to plan, to do policies, to do strategies, but global agendas were created to interrogate and change the current form of development. It's a good time to use them. What is the idea of believing, of culture in this? We need to rethink the notion of citizen trust and government. We need to rethink the notion of togetherness and to remind everyone that we are not islands, we are links. We need to have to think about space that unites us, not that the one that separates. However, and a very big however, rich nations today that represent 30% of the world population have captured more than half of all the supplies to prepare vaccines and to control them. We need a new social contract, new form of master plan, new social reset. We need to bring back sense of the public good and rethink the notion of care and to awake again a second public case, perhaps thinking in terms of the Helsinki Declaration. It is not enough to say we need to build back better, that we hear all the time. And the reason is because building back better is not only a technical or resilient thing. We need to understand power dynamics. Who decides on priorities? Which are the needs? How are the consensus that are built, and how we reshape participation that in many parts of the world today is a concession of the state and not a public good, not a right. A right to know, and right to act, and right to strengthen our civil society. We need to avoid false dichotomies and assumptions. It is not greener cities versus low densities. I will show you with some data that the discussion is not there. It's to rethink compactness and to rethink healthier cities. We need to respond to the connectivity between climate change, right to the common, circular economies, and decarbonization. It is also not a health pandemic versus an economic pandemic. We need to understand that health depends directly on the health of the earth, and diseases are more connected in an equation that talks about an environmental sustainability and resilience. Let me tell you some of the findings of this report and some of the recommendations at the end of this. We mentioned two elements. Let me talk about first of governance. Up to the end of the 20th century, it was clear that the demands for retreat of the state were very strong. The restriction of governments, alternative modes of service delivery, liberating markets, opening borders. Today, 21st century, with terrorism, with the 2008 financial crisis, and with the pandemic, we call for more state. A state that is present, a state that creates public goods, and a state that responds to everyone. But what we see with people, we see also with the state. Some people today are opting for isolation, distance, separation, discrimination, and even xenophobia. They are building walls. They are physically distancing. Other people are opting for solidarity, for compassion, for kindness, for empathy. They are building new ties and bridges. But governments are doing the same, and we are documenting this. Some countries are assuming extraordinary power. Powers they are extending beyond the state of exception. Many of these countries, apparently because of the crisis, they are ruling by decree. They are administering. They are closing freedom, closing borders, protecting, disrupting supply chains, adopting laws and regulations that restrict citizen participation. Other governments luckily are doing the contrary. They are reaffirming human relations, promoting social and institutional alliances. They are recreating a reinvigorated notion of governance, one that is strong, transparent, that is driven by consensus, that privilege public goods, common spaces, research and development, and stop speculative behavior. We need to think perhaps in terms of creating a modern welfare state. But what is this welfare state? Our Deputy Executive Director mentioned that the Global Health Security Index produced in 2019 present a fundamental finding. No country in the world is prepared for epidemics or pandemics, and all countries are showing incredible gaps for this. From 0 to 100, the global average is 40 in terms of capacity to respond to pandemics, and 160 countries are below 50. City responses are the key to the solution, but not isolated, not in this neoliberal idea that they need to compete. They need to cooperate, they need to coordinate with other levels of government. And what is important here is to recreate the landscape of national governance. We are analyzing which cities in the world. We have created in this report, or for this report, more than a global sample of cities of more than 1,000 cities. We are analyzing which ones are coordinating with other tiers of government, which others are in conflict with other levels of government, which others define their own policies, and which others do not really act if they are not told by other levels of government. We are also analyzing what works, which are the ingredients of success. And it's very clear that transparency of information, close horizontal and vertical coordination, better cross-jurisdictional collaboration is fundamental to this. We need these governance arrangements that work for the public good. In our analysis, we found that territorial diversity and COVID is so large, spreading in so many countries and cities, that responses should be multifaceted governance responses. They should involve, in different settings and circumstances, all levels of governance and mechanisms. We need much more flexibility in the governance responses, and we need to prepare also for multi-level governance systems in which national governments, cities are recognized as real interlocutors of this process. But for this, we need perhaps to recreate administrative, fiscal, technical capacities of subnational government. We need to rethink the mechanism of monitoring and response. When we analyze, and I would like that you hear this, when we analyze what is happening in countries and cities, more than half of countries in the world, they are not providing data and information of which people, in which places, under which circumstances they are. Data and information should be brought to be a public good and not to be hidden in this. Let me talk about something on inequalities. It was mentioned before that this crisis is between people and places. It's very clear to us the urban and poor are much more exposed to the virus, not only in infection, but also in disease and dying. And I'm going to present some data on this. The pandemic is revealing that there is a very fragile scaffolding of social policy. New forms of vulnerability are developing, and we need to understand them. Ethnicity is playing a fundamental role, and in many countries we need to play some form of institutional racism. I would like to provide some data on some of the findings of this report in terms of who is affected. In Brazil, for instance, when you take favelas, which are slums, very interesting finding. The rate of contagious is the same between poor or non-poor or white and black population. But when you move to people dying from the disease, the difference is 62 versus 45. In many places, people living in favelas, which very often are black population, they will have a rate of death 2 times more than the rest of the population. In France, the lowest quintile registers 60% of cases. In the United States, as we have seen very good data, Hispanic and Afro-American that represent more or less 24% of the population, they account for 64% of cases. In Mumbai and in other Indian cities, 60% of cases, according to what reported at the beginning today, with the acceleration of the pandemic, unfortunately in this country, perhaps data
Thank you very much, Eduardo. We really appreciate your presentation, which was informative, it was thought-provoking, and it really brought forward a number of important new sets of data, conclusions, and recommendation to this webinar. We will now have a 15 minutes pause. You will come back at 16:15 Norwegian time. And in the meantime, I really encourage and recommend over 700 participants to come forward with comments and questions. So, see you again in 15 minutes. Thank you. One. Good. Welcome back again. We have received some questions to Eduardo Moreno. Regrettably, we have some problems with the link and the sound to Mexico City. So we have decided to take the questions and comments with Eduardo Moreno on this innovative report later in the program. We are working on establishing contact with Mexico City. So we then move ahead to the next speaker. And from this broader outline of the situation and the challenges we are facing, we will now, in the third part of the webinar, delve into the more specific issues of health, human rights, housing, and the challenges of the global humanitarian system. So what in fact started as a health pandemic has exposed stark social and economic inequalities and system weaknesses. Already vulnerable communities before, they are hard hit, and new vulnerable groups with new vulnerabilities are emerging. So in this section, we are asking what are the more specific challenges locally, nationally, and internationally that COVID-19 has brought with it? How to approach them? What is the way ahead? So we are starting with the topic of systemic poverty and inequalities in cities, the health challenge. And please again, distinguished participants, forward questions and comments during the intervention. There will be a 10-minute question and answer session after the intervention. The speaker on this topic is Annie Wilkinson. She is an anthropologist and a health system researcher at the Institute of Development Studies, Sussex in Sussex. She's working with the health and nutrition clusters. She holds a Master of Science in Health Services Research from the University of York and a PhD from the Science Policy Research Unit at the University of Sussex. She has worked extensively in West Africa, particularly in Sierra Leone, within emergency, humanitarian, and epidemic response. So, welcome to the two of you, Annie. The floor is yours.
Thank you. Can you hear me okay?
Yes.
Yes, great. So I'll just start sharing my presentation, but it's a pleasure to be here today. So thank you for inviting me. And it's been wonderful to hear the insights from the previous speakers. Yes, so I am Annie Wilkinson, and I'm a researcher at the Institute of Development Studies. So I'm going to talk about, as Eric mentioned, poverty and inequality in cities and the health challenge. So the first question is, what is the health challenge? First of all, there is the broader trends. So the world is increasingly urban. So currently, I think it's about 56% of the world's population is urban. And urban populations in lower middle income countries are growing the fastest. We know that inequality and poverty have a range of negative impacts on health, but we do not clearly understand the social determinants of health in many of these rapidly growing urban settings. And then urban health interactions and dynamics have been overlooked and misunderstood. And we know least about the most vulnerable settings and the most vulnerable people. So in particular, the 1 billion people or more and growing who are living in informal settlements. So that's the challenge as I see it. And I'm going to try and go into a bit more detail for you. First of all, it's often said that epidemics are windows into society. And with that, they're revealing of our social relationships and our circumstances. And with these revelations comes a sense of reflection and sometimes the potential for change. So epidemics can be dramatic learning opportunities, and it's hoped often they'll be turning points or they'll trigger this change. So in the next few slides, I'm going to cover what some epidemics and our responses to them, we're going to cover what epidemics and our responses to them have revealed and what we've learned from some recent episodes. So starting with COVID-19, initially there was a lot that was positive. In the beginning, in London, where I live, there was a sense that we were all in this together. So the two pictures on the left here show some of the kind of mutual aid networks that sprung up, and also these rainbows that people posted in the windows to support our frontline health workers. But it soon became clear that the spread and the impacts of COVID-19 was not even. So inequalities in vulnerabilities and also in the outcomes soon appeared. So under lockdown in London, it made a real difference if you were, happily sitting in your house with a garden, getting your food delivered to you, or if you lived in a tower block, like in the top right-hand picture. And perhaps if you were also working as one of those food delivery drivers or care workers or Uber drivers, and in the kind of professions that we ended up seeing had higher infection rates. Similar inequalities have been found throughout the world. So the bottom right picture is Mumbai, where surveys have found that 57% of people living in slum settings or informal settlements had antibodies to COVID-19, compared to just 16% in non-slum areas. So COVID-19 has revealed inequalities everywhere, from London to New York, Mumbai, or Rio. We've seen that the way disease risks are rooted in our social and economic systems and in our built environments. So another thing that epidemics can help us reflect on is how our approaches to controlling disease and infectious outbreaks have changed over time. So historically, urban development and infectious disease have been intertwined. The first picture here on the left is John Snow's famous cholera maps, which ushered in germ theory and the sanitary reforms in many cities. And it should obviously be noted that that wasn't necessarily done with a concern for the poor or much consideration of them. But more recently, our approaches to infectious diseases have become detached from these built and city environments and detached from urban planning. Many recent outbreaks have actually had an urban dimension to them. COVID and Ebola are quite well-known examples. There was also Zika, and then other lesser-known ones, so cholera in Zimbabwe, or yellow fever in Angola, or plague in Madagascar. All of these had significant urban dimensions. But our responses of them have focused on surveillance, on drugs, on diagnostics, on vaccines, or on behavior change. So the two pictures in the middle here are people administering vaccines. The top is into the yellow fever outbreak in Angola, and the bottom is vaccines for cholera in Zimbabwe. And then the final picture is representing the kind of behavior change. So this is Zika, where women living in favelas in quite patriarchal societies and with not proper access to contraception were simply told not to get pregnant. And if you read the lessons learned reports from many of these recent outbreaks, they tend to focus on kind of technical implementation and coordination challenges. They don't focus on the urban contexts and infrastructures that facilitate the spread of disease. And they certainly don't focus on kind of power dynamics and the politics which shape those urban environments. So I'd like to just focus in on a couple of examples in a little bit more detail. So the first is the Ebola outbreak in West Africa. And as Eric mentioned, I've spent, a lot of my work has been in Freetown in Sierra Leone. So there was, if you remember the West African outbreak, there was unprecedented urban spread. And this was really facilitated by years of urban neglect. So rapid, unplanned urbanization in places like Monrovia and Freetown had resulted in dense settlements with poor healthcare and poor sanitation. And also communities that really did not have positive experiences of healthcare or of authorities. And then the public health response teams, the public health response teams were ill-equipped to deal with these environments. All of their experience really in controlling Ebola before had been in rural areas. And in Sierra Leone, I remember some of the people planning the response admitted, we don't know what to do if it gets to Freetown. And of course, it did get to Freetown. And the initial response was these kind of blunt instruments, such as quarantine. And if you remember, there's the famous quarantine of Monrovia, of West Point, which was ineffective, and it led to riots. A big challenge in the West African epidemic was that the disease came on top of long-term structural violence and experiences of slavery, of war, of extraction, corruption, which left the response capacity weak, health systems weak, but it also left publics distrustful. And then that wasn't really helped by the kind of authoritarian and violent response measures that were attempted initially. So all of that is the context as to what made the disease go out of control. But what turned it around was the involvement of communities to lead and to adapt control interventions to make them more appropriate for their settings. So local surveillance teams happened. There was also kind of more local involvement in quarantine. Community-based care centres were set up, which employed residents from the local area, all of which helped to kind of build trust. The major lesson then from the Ebola outbreak was that social and political dimensions of epidemics are as important as the biomedical ones. And that was really something that was kind of overlooked before. And that responses must be inclusive of local people and their concerns and priorities. Moving on now to COVID-19, and specifically now in COVID-19 and in informal settlements. So this is by no means over, but I think we can begin to make some observations. So at the beginning, there were real fears about kind of unchecked spread in dense and unsanitary environments. But what was less clear was the underlying kind of epidemiological vulnerabilities in places, and also how disease and control measures might spread and impact on what was actually some very different kinds of settlements. And again, we saw blanket and blunt kind of responses. So the issuing of unfeasible guidance, washing hands in places where there wasn't proper sanitation, or socially distanced in places where it was very crowded. And we saw the imposition of kind of impossible economic restrictions, so shutting down street trading or markets and all the things that people depended on. And what these responses revealed really was a failure to understand and to see the city as a system beyond risk infection, and especially not to understand the role of kind of informal economies. And this meant that the control measures that were implemented were inappropriate, really, and they did severe kind of economic and social harms. In places where state support was kind of belatedly provided to mitigate some of those harms, it was often really not available to some of the most marginalized groups in cities, so informal workers or displaced people or migrants. But more positively, social movements and community-based groups have mobilized to mount localized responses, including support networks to assist the most vulnerable. So these two pictures here are from Kenya, where the SDI federations have been working with the Ministry of Health there to offer advice about control strategies, to how to make things more appropriate for their settings, to monitor cases in their communities and to register, how much testing capacity there is, and whether cases are kind of rising or not, and also identifying sites where people could be safely isolated, perhaps, or where community kind of based care centres could be set up if they were needed. And then they've also been distributing food to the most vulnerable. And it should be noted that really these kind of more successful, the places where there have been more successful locally adapted responses, like those I described in Kenya, have been where they've been able to build on long-term collaborations and dialogue between residents and the city authorities. So in both the Ebola and the COVID example, what we've seen is these long-term vulnerabilities kind of meeting with an epidemic shock, which public health response teams really have been kind of inequipped to deal with. it has kind of led to some inappropriate response strategies. And often we see time and again the most vulnerable populations have been subject to the most damaging and often ineffective interventions. And the inclusion of kind of local people has often been an afterthought. So at this point, we really need to ask why. Why has such a situation occurred? How have cities and their inhabitants and their health been so overlooked and so misunderstood? The first point is that spending on and attention to urban development is really limited compared to health. You know, urban development actually gets much less development spend and much less attention. There is limited, another really big factor is that there is limited data and evidence on lots of urban settings. We have really, really big blind spots, particularly in informal settlements and for some of the most vulnerable people. That's because government data tends not to kind of disaggregate adequately by urban and rural, and definitely not by different settlement types. And meanwhile, actually research on urban health is quite limited, actually. And if you look at many of the studies that are on health in informal settlements, they come from really just quite a small sample of some of the most notorious settlements. So there's huge areas that we don't have good data on. There's also an absence of policy frameworks. So many countries and cities don't have urban policies, or often urban is omitted from kind of sectoral policy. So if you read lots of health and pandemic preparedness policies, they don't really mention the kind of specifics of urban dynamics. And then siloed expertise is another really big problem. And often health experts are working kind of quite separately and often in parallel to urban planners or engineers or other relevant expertise. And local local expertise is often ignored. And then finally, there is also a politics of neglect at play. So this can be kind of strategic ignorance, sometimes on the part of governments. So part of the reason that there is such poor data on informal settlements is because governments often deem them to be illegal. So they don't collect data on them because that would validate their existence, which is something they'd prefer not to do. There's also exclusionary policy and practice, and that's evident in the way that poorer, marginal, and informal residents are not routinely invited or included in planning processes. And that, of course, follows long kind of histories of blaming the poor and their problems, treating them as vectors of disease and not as victims of disease. So in an effort to better understand urban contexts and informal settlements, the first point to note is that we cannot generalize. So cities are really different. It's an obvious point, but it gets forgotten. The first two pictures show Wuhan in China and then Salvador in Brazil. Just, you know, those are dramatically different city contexts. And then, of course, settlements are different. The next two pictures show Freetown. The first is a coastal settlement, which is very densely packed and is actually kind of built out of reclaimed rubbish. And then the other is a hillside, more recent settlement, which is much less densely populated. Both of them have particular challenges about infrastructure. And then finally, there's different people. So your experiences of health will be very different depending on whether you are, for example, here, this is a male migrant worker in an Indian city or a lower caste waste picker, a female. So how to understand health inequality and systemic poverty? I'm afraid there isn't a simple answer to this. It is very complex. The first thing to note is that there are just heterogeneous social, political, and economic relations which shape urban spaces. The drivers of health and well-being comprise intersections between environmental deprivation, so things like infrastructure or poor services, limited healthcare, pollution, hazards such as floods and mudslides, but as well as social marginalization and stigma. So including those shaped by age, gender, sexuality, disability, ethnicity, and also citizenship status. Also, the ambiguous governance arrangements in cities shapes health. So cities have quite complex governance, often across kind of sectoral, administrative, and spatial scales. Municipal governments often don't have the power or the resources to kind of act in key areas, particularly on health. And in the case of land management, governance is often unclear and deliberately so. And that means that accountability is unclear. And all of this means that it's a challenge to identify the drivers of multiple intersecting inequalities in health and well-being, and to identify routes for redress. But finally, within all of these kind of structural patterns, of course, people have diverse forms of power and of agency. So just finishing up. So how can we address the urban health challenge? At the start, I characterized this as a knowledge problem, really. And I began with the window and what Windows epidemics and Windows revealed. Arundhati Roy had a slightly different take on this. She said that the COVID-19 pandemic was a portal, which invites the questions of to where? Where will we go? Many have said that COVID-19 will be a game changer or a turning point. But this was also said after the Ebola outbreak in West Africa. And 2 years later, we saw the second largest Ebola outbreak ever, which was in DRC and has only just finished. So that things will change is not inevitable, and particularly that they'll change rapidly. But the shock of COVID-19 is steeped in longer-term urbanization trends, and what happens next depends on how much we can influence the power relations which shape these trends towards inequality and exclusion. Absolutely, we need to invest, we need increased investment, we need improved data, we need more attention to kind of cities and their inhabitants. But our perspective is also vital. After Ebola, a colleague of mine, Paul Richards, had a wonderful phrase, which was that epidemiologists had to learn to think like villagers in order to get to grips with the disease. He was talking about rural settings in that example. But out of COVID-19, we need to get better at seeing like a city. So understanding systems and interactions, and especially the informal dynamics. We also need to get better at seeing like a citizen, understanding how people are expressing their rights and their entitlements and claiming accountability, and from who. And in both of those, we must also pay attention to who is not easily seen, and who is not being seen, and who is not, and what is not being counted. For example, who's excluded from claiming rights, like displaced people and migrants, who make up a large proportion of urban dwellers. All of this will require intersectoral, interdisciplinary, and intersectional approaches, which pay attention to power dynamics and are inclusive of the most marginalized. Finally, our focus should also be on the social context and infrastructures, as much as on the technical or the medical, recognizing that learning, dialogue, and collaboration will be key to progressive change. I should end just also by saying that although I focused a lot of informal settlements in the global south, many of these approaches are just as relevant to cities in the north. As I mentioned at the beginning, London and many other cities in the north have just as many pressing problems with inequality. So indeed, the problem of inequality transcends the north and south divides of development and highlights the need for universal urban development. Thank you.
Thank you very much. It's a pleasure to listen to your presentation, and we are very much impressed by the data and the information that you are forwarding, and also your advice on how we could better try to reach out to the poorer stratas of the both urban and rural poor. I like very much the picture you give of academics as windows into societies. You look through a window in two ways, from the outside and from the inside. And I think Johannes has a question relating to the relationship between marginalized groups and academics, particularly researchers. Please, Johannes.
Yes, there's one question here from one of the listeners, and that is, if I understand it correctly, is how is your research and that of your teams fed back looped into the marginalized groups? How do you provide provide them with arguments for the local and national governments?
I'm really sorry, I didn't hear the question.
Okay, I can take it once more. Sorry. How is your research and that of your teams fed back, looped into the marginal groups, or how do you provide them, these marginal groups, with arguments for their advocacy vis-à-vis local and national governments?
I think this is about
how do we.
This is about the relationship between the researcher and the poor groups. And the question, I think, in a way, is how do you provide poor people and their organizations and their movements with arguments that they can advocate vis-à-vis local government and national government, not to say international governments?
Okay, so the sound hasn't been great, but I think the question is about how do we include marginalized groups and social movements in our research and equip them with, and reach urban stakeholders. That's what I'm going to go with. So actually, lots of the research that I was drawing on there comes from research that has been done in conjunction with social movements and the residents themselves. So we do a lot of participatory work, participatory research methods. The projects there was one of the projects at the end was Arise, which is focusing on urban health and inequality and accountability. And there all of our data collection is done with co-researchers from who live in the settlements. And so they're involved in the kind of planning of research, analysis of research, and then also developing the kind of findings and thinking about which kind of urban governance actors to target. I hope that's clear.
Good.
Thank you. I've also got one question from Mohammed Khalidi, and he asks, do you have any examples of the micro solutions some communities may take to combat the inequality problem?
Do I have examples of the kind of solutions?
The micro solutions. Micro solutions some communities may take to combat the inequality problem.
Okay. So the project that I was actually just mentioning was one of the is in the early days. So we're hoping to develop kind of strategies to address inequalities. And I think at the moment what we're finding is actually there's often quite limited forms of accountability. Or there's kind of like what we've started to call, or some other colleagues have called, rude accountability. So actually just kind of, unfortunately, kind of getting angry about things. In Sierra Leone, it might be phoning up a local radio station and complaining about something. And that has some effect, but it doesn't actually kind of, it's not exactly a kind of a powerful kind of accountability mechanism. So we're hoping to develop those. The other thing I'd say is in terms of controlling epidemics, there's a lot of examples I tried to show in the Ebola example about how local people actually kind of came up with their own solutions, whether it was doing their own quarantines or their own surveillance, then that would be a way that they could kind of address the more inappropriate kind of disease control.
Excellent. Thank you very much again, Anne. It has really been a pleasure to have you with us, and I think your research and your work for an association like Habitat Norway, focusing on social sustainability, poverty and inequality and grassroots movements, it's very, very important. And I really hope we could develop over cooperation and communication, and that your presentation will find its way into the final report of this webinar. So thank you very much again, and take care in Italy. I hope you are not in the northern part of Italy, but that you are in the southern. Thank you very much.
Bye-bye. Thank you.
Great. Then we will move on to the next intervention with the topic not just a health emergency, but a parallel pandemic of human rights. We have asked Professor Fionnuala Ni Auluen to respond to this question of high relevance and actuality, not least to the UN and the multilateral system. Fionnuala is, since August 2017, the UN Special Rapporteur on the promotion and protection of human rights and fundamental freedoms while countering terrorism. I hope I got your title correctly this time, Fionnuala.
Yeah.
She's a University Regents Professor at the University of Minnesota and Faculty Director of the Human Rights Center at the University of Minnesota Law School. Currently, she is a Professor of Law at the Queen's University of Belfast School of Law. Her teaching and research interests are in the fields of international law, human rights law, national security law, transitional justice, and feminist legal theory. She has been appointed by the Secretary General of the United Nations as special expert on promoting gender equality in times of conflict and peacemaking. Fionnuala has published widely, for instance, on sex-based violence in times of war. So it's an honor, it's a pleasure to give the floor to you from Minneapolis in the northern Norwegian part of the United States. Please, Fionnuala.
Great, thank you. Thank you. And I'm really pleased to join you all and to focus my remarks on this question of the security and human rights challenges that we face today, as well as the pandemic challenges. And so maybe let me start by contextualizing the state of human rights and rule of law around the world. I want to underscore that human rights protection and promotion is under severe and undulating strain. That was true before the pandemic, and it is still true now. Can you hear me? Yeah, good. So just a couple of statistics. It's estimated that civic space is restricted or impaired in its operation in over 130 countries. In 2019 alone, 300 human rights defenders were killed, including a rising number of women who are human rights defenders. Torture, inhuman and degrading treatment remains widespread and institutionally tolerated. And it's fair to say that human rights remain an uphill struggle, and they remain an uphill struggle even more so in the time of pandemic. And the voices of people making claims for human rights and for the rule of law continue to break through even in the pandemic. So let me say a little bit why I think that the human rights situation is so dire and why it in some ways is a parallel epidemic, and what we need to do to address it. So many of you tuning in will probably be aware, at least at a general level, that the multilateral system is under enormous strain. We see this in UN and other multilateral fora. Most of all, what we see is the chronic underfunding of international institutions. And we see, and I see it every day in my work, the increased challenges and tensions of addressing common global problems. We see increased tension between states. Just this weekend, Nagorno-Karabakh has reignited. We see the Sahel, we see Iraq and Syria still. We see Libya. All of these are extremely challenging. And all to say that much of the production of these challenges and tensions are produced by the fragmentation of the multilateral system itself. I want to note that we have particular problems with the role of the Security Council. Not only is it increasingly dysfunctional, but it often now, when it does function, functions as a super legislature. And from where I sit, what we see is the securitization of complex issues rather than addressing them in nuanced, governance-based, complex ways. And it's also true to say, so that first sort of prong is the weakening of the multilateral system. The second prong is what I've said to already, is the backlash to human rights and the undermining of the rule of law. It makes addressing a global pandemic that often depends on the law to enforce its rules really problematic. What we see is that undermining happening not just within particular states, but also in multilateral fora, where states, large states, authoritarian states, and populist states use those multilateral fora to undermine the rules that we spent half a century building. In particular, we see the constraining, again, of civil society space in many of these fora. The third motif I want to raise is the rise of securitization and the view that security is the primary mode of response to complex issues. And the place where I see that, of course, every day in my work as Special Rapporteur is the use of counterterrorism and security discourses to address complex, fragile, and non-functional societies around the globe. There's a really important point to make that we often see in the climate change discussion, an increased use of the language of security to address climate change. And there's a seductiveness to the security and climate interface. And it is not to say that I think that we don't have security challenges with climate, but securitization is not the response that will address our climate challenges. And the danger is that for many governments, the seductiveness of hard-edge security responses will drive climate change responses. And that is something I think we should all worry about. Fourthly, I want to say that we see an increased relationship between climate harms, resource fragility or resource scarcity, and violence in many countries. And again, it is the lack of thinking beyond a securitized response to the violence. So we respond to the violence first without addressing the underlying fragility and insecurity that's driving the violence in the first place. Finally, let me close out by saying a little bit about COVID-19. And I want to say that I think we are in a very dangerous space where COVID-19 has the capacity to embolden authoritarians and to embolden the securocrats in many states. I should note that the mandate I hold issued an early warning with a number of other special rapporteurs on the use of counterterrorism, security, and emergency measures in the context of COVID-19. We've also created, my mandate with two small NGOs has created a global tracker called the Freedom Tracker that's tracking the use of exceptional powers by states across the globe in the context of COVID-19. And so just to say a little bit about that, we're seeing massive use of data tracking technology, including the most sensitive data, biometric health data, for example, without any or sufficient protection of the storage, collection, use, or transfer of that data. We're also seeing the hard edge of security as the way to manage the crisis. And given that we know that the policing of COVID-19 has exacerbated discriminatory patterns in the abuse of use of force, and the evidence we have that epidemiologically, it is historically vulnerable groups, often minorities, communities of color, who are most affected by COVID-19. The proposition that it is the security state who will manage COVID-19 in those communities and should worry us all, not least because the security and force capacity of the state is being mobilized against those who have the least trust and who have experienced historically the most harm from states. Maybe let me close on a positive note after all of those bad news items. So the positive note is that the COVID-19 pandemic has created a new conversation about human rights. For example, the fact that we are all in lockdown, the fact that we are all in our homes, those of us who are lucky enough to have homes, and those of us who have access to health, there's an emerging consensus, it seems to me, on the centrality of the right to life, the right to health, and the right to adequate housing as fundamental rights. So if there was a debate before that health is not a right or that housing is not a right, COVID-19 has helped us shift that debate. I think it has also demonstrated the innovation of civil society. Even in lockdown, in places that are struggling around the globe, civil society has been enormously imaginative, enormously creative in responding to overuse or abuse by the state. And so we're seeing new opportunities to organize across the globe, including in these virtual fora. So I think these two threads, the new conversation about rights and the ways in which we think about organizing and claiming rights, are some of the positive things that are coming out of COVID-19 and the parallel epidemic of human rights violations and rule of law deficits that have been long in the making. So let me stop there and happy to take any questions.
Thank you very much, Fiona, for your thought-provoking remarks. I think it's very important to hear your analysis of the challenges of, for instance, the multilateral system, particularly for a country that recently has been elected to the Security Council of the UN. While we are waiting for questions and comments from participants, I just have one question, and that is, how is this pandemic situation with global repercussions, how is it influencing or impacting your work as a special advisor? Because I in a way see the special advisors as very important players in the UN system. You are a sort of devil's advocate. I mean, you are critical, you are outspoken, you tend to be very, very important and conveying messages that no one else dares to present. So, does the pandemic have any impact on your independence?
Yeah. So thank you. And I do want to acknowledge how important it is that Norway has been elected to the Council. It joins Ireland, my home country, and Mexico at this moment. These are countries who have historically defended human rights and who have historically defended civil society. Norway and Ireland, for example, lead on the civil society protection resolutions at the Human Rights Council in Geneva. And I think it's a very important time for Norway on a council which rarely listens to civil society and for which human rights is often marginal, to exercise its muscle, to be the conscience. It's very difficult for the non-permanent members to be really, they work in a system that works against them because the permanent five have inbuilt advantages. but they have a strong role to play in being forceful, also being a thorn in the side of the permanent members, a little bit like independent experts. And I hope that Norway will embrace that role, particularly embrace the role of speaking for and bringing the voices of those on the ground, as it has done in so many other contexts, to the Security Council. For me personally, it's of course a challenge. We're not traveling anymore. And part of the way special rapporteurs like myself do our work is we are on the ground. And we are the voice of conscience. We see things and we say things. So when you physically cannot access the countries, it creates enormous barriers to being that voice of conscience and the person who speaks. I will say, though, that for me, our work has increased. We are seeing in the area I work in, securitization, counterterrorism, we see many countries taking advantage of the lockdown. We see many countries locking up lawyers, civil society activists, human rights defenders, moderate critical leaders under the cover of COVID. And so in some ways, our work is more hampered, but also we're seeing more abuse, if I want to say, by states, because other states' eyes are elsewhere.
Good. Thank you very much for ending up on optimistic and positive note. Do we have any questions, Johannes?
There is no. There was approximately the same question as you asked, Erik. It's nothing yet.
So thank you very much again. We hope your important presentation could be included in the report from this webinar, and we look forward to communicating with you in the days and weeks to come. Thank you very much, Fiona. Thank you.
Thank you, and I appreciate the importance of this conversation as Norway prepares to join the Security Council and to be an active voice on these global issues.
Thank you. And Ireland. Good.
Thank you. Yes. It seems like, Erik, that we're having some digital problems, but I think we'll have Moreno now back with us again.
Yes.
And let's see if we can connect with him now. Mr. Moreno, can you take off the YouTube link that you have on your computer? If you turn off your... Can you take off the YouTube link that you have on your computer? If you turn off your... Then it's perfect.
No, it's perfect. Okay.
I'm sorry, I don't know what happened.
No.
Apparently, I continued talking and I didn't realize I was not connected.
No, it's all right. You are with us now, and we have a few questions from our side. Thank you very much for a very informative and innovative presentation, Eduardo, which we really enjoyed. So I think Johannes, he has some questions.
That's correct. Thank you, Erik. So we're jumping back to your presentation now, Moreno, and there's actually two questions that we have, and that is one from we got from YouTube here. What would be the central problem? Global biomobility or ecosystem of a new global mobility?
Okay, what is the central problem? What is the first? The central problem? What is the first part?
What is the central problem here? Would it be a global biomobility
would it be the global biomobility, or would it be the ecosystem of a global mobility?
Okay, yes. No, obviously, to me, and the analysis that we have done, it's the problem. The problem is as I mentioned before, is the way we were addressing ecology, is the way we were addressing climate change, in the structural inequalities in cities, is the problem of not integrating clear responses in terms of cities becoming so important, but at the same time, with unsustainable modes of production and development, continuous violation of rights. 75% of cities were more unequal. It's not the system of global mobility, it's the system of ecosystem development. And I think the new normal will represent the extent to come back to this fundamental notion of understanding proximity, understanding connectivity, understanding densities, understanding relationships, and overall on this, societal relations in terms of togetherness, empathy, and a revolution of identity and change. I think we need to address this fundamental thing in order to respond to the problem. To tell you, when we analyze how inequalities are playing in the pandemic, it is very clear that it's a divided world, but it's a divided pandemic. In a way that, for instance, poor communities, and we need to recreate, and that was one of my important points, the notion of vulnerability in cities. If you take slums or poor areas and you take COVID, they don't overimpose exactly, because here we are talking about different forms of inequalities, different forms of vulnerabilities that are associated to mobility, that are associated to work, and that are associated to place. And in this relationship, what is important is to understand that ecology will play a fundamental role. It seems that it's very noisy, my response, isn't it?
No,
it's okay.
It's okay? Okay.
Thank you.
Good. We are slightly running out of time, Eduardo, but I have one immediate question, and also reflecting on the fact that you are providing a lot of important new data, conclusions, and recommendations. I mean, this report is obviously a very important report. And how will UN Habitat utilize the report in its normative and operational work? And how will you disseminate it, and how will you feed it into the international discourse? And not the least, how will you feed it into the UN, who definitely need some new perspectives and challenges on what we are facing?
This is a very important question, Eric. Thank you. UN Habitat wants to use this report, the findings, the data, the recommendation, in order to relaunch a global debate on what is happening in the world with COVID. What kind of responses, emergency responses, cities and governments are taking, what is needed to improve this, and what kind of solutions we can propose for in a global discussion with our development partners. We can address some of the fundamental things, some of them related to the role of the state and the government in cities. The other one, the fundamental role, as I mentioned, of how inequalities are playing and what kind of solutions are needed. And third, about the form of the city, what kind of solutions are needed. So my response to you is that we create the global evidence. A global database of more than 1,000 cities analyzed on what they are doing, what they are changing, and what kind of responses they are implementing. This database is providing us the critical mass of information to understand how policies are worked out, where solutions are taking place, where good ideas, innovative, I would say best practices are being implemented. We want to bring this to the overall discussion. How we are going to do that? We are going to produce 4 different reports for each one of these parts of the report, and we are going to launch discussions like this with you. We hope to do another one on specific themes in which we can analyze what the world is doing, what is needed to do, and how the international community can play an important role in addressing some of these things, really to embrace a new normality in which some of the fundamental issues are structurally solved. So it's a lot of data-driven, it's a lot of knowledge-driven, connected to the possibility of policy responses. And we want to drive this global debate through different means, with governments at the national level, with network of cities, the most important that are our partners, and with NGOs and with other partners to discuss what we are finding in this report.
Very good. Thank you very much, Eduardo. As a civil society association, we certainly hope to continue the discussion with you. And we look forward to including your presentation, your keynote speech, into the report from this webinar. So, thank you again, and take care in Mexico City. I hope it's not too polluted now, maybe on the contrary. And we will move on to the next intervention, which will be on housing. We ask the question on the issue of dense cities and community emergency mobilization. How could we support economic recovery through community empowerment by linking resilient and affordable housing with livelihood strategies? We have asked Milon Kothari to respond, and Mr. Kothari was appointed as the first UN Special Rapporteur on Adequate Housing in 2000.
Erik, could we just ask? Okay, yeah, sorry.
Okay. So, I was about to introduce you, Milon. I start from the beginning again. You were appointed as the first UN Special Rapporteur on Adequate Housing in 2000. This was a position that you held until 2008. Milon is an architect by training, graduated from the Pratt Institute and Columbia University in New York, and the Maharaja Sayajirao University of Baroda, India. He has extensive experience in the area of housing and land rights, and has been actively working through his various functions to promote the realization of the whole range of economic, social, and cultural rights. Since 2015, Milon is the president of the Universal Periodic Review. He has written more than 50 publications on housing and related development themes. And he is also a contact person for a large number of local, national, and international non-governmental organizations. Habitat Norway certainly would like to link up with you. So, during Milon's intervention, I request our participants to forward questions and comments. Milon, the floor is yours.
Thanks very much, Eric. Can you hear me? Yeah, okay. Hello everyone. And it's wonderful to have this opportunity, and I really enjoyed the speakers that preceded me. I also welcome very much the focus on human rights in this webinar, which has been considerably strengthened, I think, by Fionella's presentation. And I also very much welcome the fact that UN Habitat has finally embraced the human rights approach. It's been a long time coming, but it's very good to see now that there's an attempt being made to integrate the human rights approach, both in terms of analysis and in terms of solutions into the various programs of UN Habitat. My presentation is not going to directly address the COVID crisis. I think that the global housing crisis precedes COVID, has been exacerbated, as we've been hearing, by COVID, and probably will continue for some time after COVID. So what I want to actually present is more how do we get out of this? How do we get out of the colossal global crisis that we have? And in that sense, I would like to focus more on sort of positive developments, instruments that exist, and on good practices that are available, which are unfortunately not being scaled up or used by governments. So the first issue I wanted to address is the issue of affordability of housing, which is a major crisis. And in all the years that I have worked on this issue, two of the best examples of how do you tackle affordable housing are something called the housing first approach, and the second is the housing continuum approach. Essentially, the concept of housing continuum comes simple, the coded idea that in all societies, a gradation of housing options should be available such that everyone can have the right to adequate housing. And I will go into this a bit, but if the continuum approach is made a cornerstone of national housing policies, then we can overcome many of the unsustainable gaps that we find in housing options around the world today. The other compelling part of the housing continuum is that it looks at the non-discriminatory part of housing. So it applies to all groups that are in need of housing. And so the idea is very, very simple, that any society should have a gradation of housing options. So you should have shelters for the homeless, you should have shelters with care, you should have working housing, so housing for migrants, housing for working women, you should have cooperative housing, you should have affordable rental housing, you should have affordable ownership housing, and at the very end of the spectrum, you would have market-based housing. If this very basic concept is adopted, I think it would take us a long way. And I think as we have seen through COVID, many of the vulnerable groups I've seen in my country, migrants, in fact, have very poor housing in the cities, and in fact, very poor housing where they live as well. The housing first approach is more a very direct approach that says everyone should have adequate housing. And this is, being applied in Finland, it's being applied in some other countries, but it's not entirely practical, for example, to deal with structural issues of homelessness and so on. So these two approaches, I think we need to study more carefully and integrate the very strongly human rights-based approaches. The second problem I wanted to address was the issue of the ongoing global crisis of forced evictions and displacement. We have a colossal crisis in the world where, and I'm not only talking about conflict and disasters, where millions of people are being displaced from their homes and because of so-called development projects. In the country where I live, in India, for example, a recent report by the Housing and Land Rights Network showed that in a period between mid-March and mid-June, around 14,000 people were evicted during the COVID crisis. And this is not only in India. We have seen evictions in Brazil. We've seen evictions in Kenya. We've seen evictions of Roma people in Italy, for example. And so I would stress that the last 30 years, there's been a significant amount of work done in the UN system on preparing instruments and so on to tackle this kind of an issue. But also we have a situation where, let me just quickly run through some of these instruments, and they can be very useful. So, for example, when I was Special Rapporteur, I worked on something called the UN guidelines on discrimination, segregation, and the right to adequate housing. And as we heard from the presentation of Fionela and Annie, the disproportionate impact that we see of COVID is because particular groups are marginalized and discriminated. So we have some standards that can be used by governments to inform policy. Part of the work came out of the Durban conference on racial discrimination. The second is very critical today is an operational instrument called the UN Basic Principles and Guidelines on Development-Based Displacement and Evictions, which were presented to the Human Rights Council in 2007. And this is very important because approximately, and I'm quoting a statement from the Executive Director of UN Habitat on World Habitat Day in 2018, when she said that approximately 2 million people are forcibly evicted annually, and thus this must urgently be addressed. While UN Habitat advocates for sustainable urban development and planning and concedes that resettlement may be necessary at times, such actions must be a last resort and should strictly conform to the UN basic principles and guidelines. And so these guidelines are operational. They talk about prevention measures, the training of security of tenure, the carrying out of eviction impact assessments, compensation, the right to redress, and so on. And that eviction should only happen in exceptional circumstances. And this is what we are not seeing today. So you have that. Then in the Special Rapporteur who came after me, Raquel Rolnik from Brazil, prepared a very interesting set of standards called the Guiding Principles on Security of Tenure. So essentially, she looked at all different forms of tenure and also the context which undermine tenure security, and the wide range of tenure arrangements that exist, but that need to be scaled up. But she made some very interesting points in this instrument, which says that if there is security of tenure, it should be based on certain principles, and this is very much the rights approach, promoting the social function of property, combating discrimination, respecting the security of tenure in business activities, and so on, empowering the urban poor. So these are three instruments that I think we need to look at more carefully, and we need to, we need to convince countries to adopt. And as Fionela was saying, I think one of the positive aspects of COVID has been that countries are beginning to look at the rights approach, because everyone has seen the violation of rights that have taken place. And the final issue I want to raise is something which is very, very critical, which is the issue of the rural reality. I've often said that there is in the world a type of an obsession with urbanization. Yes, urbanization is happening at a very, very fast rate, but we are neglecting the rural reality. So, we have entire regions of the world, where I come from in South Asia, your sub-Saharan Africa, where in many countries up to 75% people live in precarious conditions in rural areas, and around 3 billion people. And the absolute number of rural inhabitants in Africa and Asia is projected to increase actually over the next 30 years. Most of these people are peasants, are poor farmers, and the scale is just astonishing. And it's actually very surprising to me that in the global debates, this reality is completely neglected. Let me just very quickly give you some figures from India. We have 170 million rural households, 100 million of those, it's about 56%, do not own any agricultural land. 90% of the landless poor are the most marginalized, the scheduled caste, the Dalits, and indigenous tribal people. And there's a very, very disturbing gender element to this, that 35% of the rural households are women-headed, but less than 2% of women own land. Now, there's been a number of attempts to tackle this issue. We have a very interesting example in India called the Right to Homestead Act, which is there in some states, but there's an attempt being made now to make it a national law, which would make it possible for every landless family to have land for farming, but also for, excuse me, for to grow, subsistence crops. And so the enactment of that kind of a bill would also be consistent with some of the new instruments that we have seen. We have recently had the adoption of the UN Declaration on the Rights of Peasants and other people working in rural areas. We have the voluntary guidelines on tenure security from the FAO. And so there is a need to operationalize the right to food, land, and housing to have countries to fulfill their international commitments. So I think that there's a lot there that has been developed. We really need to study it. We need to analyze from a rights perspective. I don't think, in closing, I would just say that that the human rights approach has always been an imperative before us, and the COVID crisis has just made its implementation all the more urgent. And I would, be very happy to take questions and perhaps provide resources on how people can learn from and understand this process. And of course, there are existing UN special rapporteurs on housing, on extreme poverty, on the right to food, on indigenous people who, and you just heard Fionella also, who would be very willing to engage, I think, with UN Habitat and other actors, because housing is a much broader issue. As I mentioned, the issue of land rights is perhaps even more critical, both in urban and rural areas. And I look forward to the discussion. Thank you very much.
Thank you, Milon. Thank you for a very stimulating intervention. It was a real wake-up, particularly on the situation of the right-based approach and work within both UN Habitat and the UN system. My background, I have worked 35 years in international development. And one general question that has popped up is, how would you explain the neglect of multilateral and bilateral donors of housing and urban social development generally? Because there is a neglect. In average, only 4% of official development assistance has gone into social urban development since 1970. And there is hardly any bilateral agency that promotes housing. I don't think on the multilateral side there has not been anything since the World Bank's Sites and Services program in the late 80s and early 90s. So could you please, how do you explain this absence in urban development?
Oh, I think, Eric, there are several explanations. I think what you're saying is also mirrored on the national side. So even at the national level, the budgets for health and housing are very, very low compared to other sectors. Yes. I just think that it's an accepted part of social reality a lot. And I think the COVID has brought that out, that a lot of decision makers were blind to this reality. They did not want to confront it because it's at such a large scale. I think there has been an issue around perhaps not having, as I mentioned, the issue of rural housing. We don't have a UN agency that deals with that. There's also a sort of lack of response even from within the UN. I was very surprised when I was a rapporteur, when I went to many countries on missions, that the UN country team was not even aware of the housing situation. So I think there's a kind of a sort of amnesia almost to that. Housing is not as sort of newsworthy or exciting an issue which you can raise. You can have global summits on food. You can talk about now there's a lot of talk about health. But somehow housing always slips through. I mean, it's very interesting. In some countries, there isn't even a ministry of housing, or if there is, it's a very less, minimum resourced ministry. And the other problem, which I really want to point out, which we can have a whole discussion, is that housing is seen as property. It's seen as a commodity. It's seen as part of the financialization system. So it somehow has not transcended that into becoming a social good or something that we can say is a basic right. And even though rapporteurs and others have been struggling with this concept, I just think that if you ask my very frank opinion, there are a lot of people in decision-making positions who are benefiting from housing as a market commodity. People are investing in that, they're speculating in that. One of the shocking aspects is that governments are not controlling the real estate market. Why do we have such speculation? Why do we have this global crisis of affordability? And the last point I would make, Eric, is that the people who are responsible for violations of the right to housing, when we talk about displacement or we talk about, keeping people in high density situations, or keeping people in informal settlements or out on the streets, or there being a problem of homelessness, these people are never held to account. So they're never prosecuted, they're never charged with crimes, because these are crimes. And so they know that they can get away with just neglecting people and evicting people. And so we have a colossal, I would say, sort of almost a mindset problem which we need to overcome. And this is where perhaps UN Habitat can also do some work on informing and educating governments and donors on why the issue of housing is a right, why it's so important. Perhaps now with the COVID, people have seen that, and maybe they will be more open to dialogue, the kind that Eduardo was mentioning, that we need to have more dialogues, not on statistics, not on indicators, not on methodologies and matrices, but on the basic question of mindset when it comes to housing.
Thank you very much. Johannes, do you have any questions?
Yes, I think we have to move on, but I would urge you to. There is a discussion going on in the YouTube channel here, and I will ask you these questions on email, and maybe, or you can even join the YouTube chat and answer, because there's some questions about resources and data on rural questions.
Okay.
Very good. Thank you very much. Very exciting discussion. And I very much like your conclusion, which is that we need more dialogues on the basic issues of mindset. And I hope Habitat Norway also can contribute into that discourse. So we look forward to a continued cooperation with you, Milion. Thank you very much.
Okay, thank you. Thank you.
Good. Then we move into today's final intervention, that of humanitarian challenges. And we ask the question, how to respond to long-term complex challenges and short-term crises. So we have invited Jan Egeland, Director, Secretary General of the Norwegian Refugee Council, to respond. Jan Egeland is 63 years of age, a Norwegian diplomat, political scientist, humanitarian leader, and former Labour Party politician. He served as State Secretary in the Norwegian Ministry of Foreign Affairs from 1990 to 1997, and as United Nations Under-Secretary General for Humanitarian Affairs and Emergency Relief Coordinator from 2003 to 2006. He has served as Director of Human Rights Watch Europe, Secretary General of the Norwegian Red Cross, and Chair of Amnesty International Norway. Since 2013, he has been Secretary General of the Norwegian Refugee Council. So he certainly speaks with authority. But regrettably, Jan has been prevented from participating digitally this afternoon. So the Refugee Council has produced a video interview with him that we are very pleased to present. And it's a welcome change to the standard pattern of webinars. Please enjoy.
Hello, thank you Habitat Norway for inviting NRC to be part of your discussion today on pandemics and future cities. And we're joined today by our Secretary General, Jan Egeland, who, as you know, is a former UN Under-Secretary General for Humanitarian Affairs and Emergency Relief. Jan, thank you for having us today.
Thank you.
So we've a lot to discuss, but mainly what we're going to discuss first is get Jan's view on the current response to the COVID-19 pandemic. But also we'll discuss what still needs to be done to improve urban development for displaced people within a health, housing and humanitarian context. So we've got a lot to discuss, so let's get started. Okay, so Jan, firstly, I'm going to take you back to 2005 and your role at the UN, where you launched the Central Emergency Fund. You essentially reorganised the UN's humanitarian work. Looking back then and now, what are the systemic challenges you still see given the multiple crises we're facing in the world today?
Oh, there are so many systemic challenges. I think we have to recognise that too many people suffer alone. In too many crises, in too many conflicts, in too many disaster scenes. Our ambition level should be to reach everyone with a minimum of assistance, and we're not, even in the age of 2020. The 2005 reform came at the wake of the Darfur crisis, where we felt we were not reaching people in Western Sudan at all. And also, of course, this the mammoth Indian Ocean tsunami, where we also had tremendous problems of coordinating sufficiently well in a very massive relief operation. Now, looking back 15 years later, I would say that it's mixed, the picture. In terms of assistance, we have made big progress. You look at mortality, morbidity, it's down. You look at the children in school, even in the worst of crisis, it's up. Disease control is better. Nutrition levels are better. Shelter provision is better. Clearly, there has been, in most crises now, tremendous progress compared to the crisis of that time. Perhaps the area where we fail the most is in protection. So, I mean, in urban warfare today, there seems to be no rules. I mean, people are maimed, they are killed massively still. Look at Syria, look at Yemen. There are too many crises where people suffer without any protection at all. But also in the Congo, in the Sahel now, one massacre after the other. So I would say assistance is clearly better, but far from good enough. Protection, we've made too little progress.
And we're talking about multiple crises. Not only do we have multiple crises on top of another crisis, which is, as we know, the COVID-19 pandemic. As you know as well, it has exposed stark social economic inequalities and system weaknesses. So what can we learn from the last couple of months, and what new ways of working do we need to adapt to continue to improve responses at all levels?
Well, the pandemic is unique indeed. I've been a humanitarian worker now for 40 years. There's never been this kind of a global crisis. I mean, we were in lockdown in headquarters here in Oslo at the same time as they were going in lockdown in the Middle East and Africa. We had people stuck, unable to do their job in too many places at the same time. But I mean, again, two takeaways so far, and we're now, starting October 2020. Pandemic has been there with us now for half a year. I would say, if anything, the virus has been, well, as bad as we thought itself, the disease, but not much worse. What's been much worse than what we expected is the socio-economic meltdown for all of these communities in the south. Virus has in some places been even worse in the north than in the south. You look at the old population of northern Italy and so on. But in the south, it's been this socioeconomic devastation. Tens of millions of people were living on a daily wage. The $1 a day they could get from whatever was available of work.
Wiped out.
It's gone, exactly. So hundreds of millions of people are facing a tremendous crisis this winter. And the financial system seems to be, keen on doing one thing: save the richest economies. The G20 group of the richest economy on earth spend 11 trillions on themselves and a pittance on the most vulnerable of societies, and we're getting too little for our humanitarian work. We who are in the field saving lives real time at the moment.
And so, as you know, NRC launched a report last week called Downward Spiral, and it really mainly focused on those secondary impacts, as we say, that is really impacting the likes of the refugee community and displaced people. We offered key recommendations. Jan, you've been saying this for a long time. What does the international community, the likes of the World Bank, the G20, local governments, national governments, what do they need to do?
Well, I think they have to get their governance to really realize we're in one boat here on Earth, a little Earth, 7-8 billion people now, we're in one boat. And if only first class on the ship is concerned with themselves, and the third class on Titanic is neglected, we're all going to sink. Mm-hmm. So there has to be a much more concerted effort to get the crisis-stricken societies in Africa, in the Middle East, in Latin America, to be included in the collected effort. So again, the downward spiral report of ours was documenting that more than 70% of families had lost the income, the little income they had. They had cut at least one meal per day. Mm-hmm. They were less likely to send their children back to school. I mean, 70% saying we cannot really afford anymore to send our children back to school. It's a tremendous warning signal, and I hope that these $1 trillion and euros rescue packages will be much more evenly spread in the future. If not, we will have massive instability. We will have spread of a pandemic that will come back to haunt us in the high north.
And there's still time. I mean, it's not going away anytime soon, the pandemic. I mean, there is time to improve the current systems.
Absolutely, there is still time. There is, but at the moment, people are making budgets for next year. And the signals are not good. So yes, there is time. It's amazing what we can do. I mean, we have 15,500 relief workers in the field. They have been able to reach more people this year against all odds than last year. We're reaching more people in spite of the pandemic, so we can act. So can our UN agency brothers and sisters, so can the local non-governmental organization, local civil society or organization. But the signals is that parliaments and governments are cutting budgets for next year. It would be a historic mistake if they do that for foreign and international assistance.
You also say, and I'm sure our colleagues at the UN Habitat would agree, that they often feel frustrated when they see donors prioritising health, quite rightly so, but neglect the likes of shelter and housing programmes, despite the two components, if worked and funded adequately, actually, support each other and reduce poverty and improve health. How can we fix this?
Well, indeed, I mean, this is the time to prioritize health for sure, and all of the other aspects of international assistance. But where we agree very much with our colleagues in UN Habitat, with whom NRC and especially and also our expert deployment capacity, NORCAP, work closely together in the field. Where we agree is that housing, shelter, urban planning is health. What we see is if people live in damp, crowded conditions, they will be sick. It will cost society, it will cost the world. We've been now working in Lebanon for many, many years among Palestinian refugees, now massively for Syrian refugees. Where there is bad shelter or housing, where displaced and refugees live in crowded conditions, there is bad health, there is bad employment, there is bad education, there is bad everything, and everybody loses.
You say it a lot, community communication and inclusion is key. 60% of refugees and 80% of ADPs live in local urban areas and environments. But policy responses are often developed at national level. How can donors possibly know what the needs are of ordinary people on the ground?
Well, indeed. I mean, the refugees and the internally displaced people, they live in urban settings. Very few actually live, 1 in 10 at the most, live in camps. So everybody thinking, you work for refugees, NRC, or internally displaced people, your work is in camps. Well, yeah, 10% of our work is in camp. The rest of the work is among people who live in informal, settlements. They live in cities. They live on the street in cities. They have flocked to the places they thought were safe and where they thought they would have some income and some protection and some education and some future. So how do we help them? By communicating with them. Listen, I mean, they are experts on their own needs. They're expert very often on what it would take to get them into a durable solution, what kind of education is needed, what kind of livelihoods is possible, what kind of shelter or housing needs are most appropriate, etc. So we need to set up real-time, continuous, frank feedback mechanisms where we consult the people, and not only the community elders, or not only the powerful men in the community, everybody, the mothers, the youth, the families need to be consulted. I see that as a major priority now for all of us, to be much better in communicating with the people so that we can serve them better.
We'll finish on the fact that we're talking about pandemics and future cities. What would you like to see cities in the future look like in terms of a better life urban life for refugees and displaced people? What's your vision?
Well, I mean, they need to be better planned, they need to be better administered, they need to be better executed as urban settings that are becoming bigger and bigger. Of course, here we work with UN Habitat in many places, both as the field operations of the Norwegian Refugee Council NRC and through NORCAP, our expert deployment mechanism, where we send hundreds and hundreds of experts to work with the UN system, including UN Habitat and in the field. My hope is that we will make progress in making the urban areas, the towns and the cities, safe, environmentally friendly, using green energy, etc. But also, a protected place for the most vulnerable. So it's not shot to pieces, or it's not a death trap the next earthquake comes, the next natural disaster, of which there will be many, many more. The sea rise that we can expect should not engulf these places. Need to be planned, really, and we need to have partnership in making them safe and good places where people and communities can thrive and take good care of themselves.
Well, we'll leave it there. Thank you, Jan, for your contribution. Thank you, Jan Egeland, and thank you at the UN Habitat for having us today. Enjoy the rest of your discussion. Thank you.
Thank you.
Thank you. A great vote of thanks to Jan Egeland and the Norwegian Refugee Council for producing this video. You will find the video on Habitat Norway's homepage, and there will be an opportunity, as for all the other interventions, to forward questions and comments. Regrettably, Mr. Egeland is not with us, so he will not be able to respond directly. Then we have come to the last part of our 3 hours webinar, conclusion, the way ahead. And since Professor Stiglitz could not join us, we have asked Helge Onsrud, member of Habitat Norway's executive board, to sum up some of the main outcomes from this event. And as I said many times, we intend to collate all contributions in the report that will be made available to all of you on request. So from my part, as moderator, before giving the floor to Helge, I would like to thank you for your contributions throughout, for your thought-provoking analysis, ideas, and proposals. We will take all of them with us into the long and dark winter nights that await us. To end with a quote from the American poet Robert Frost, "The woods are lovely, dark and deep, but we have promises to keep and miles to go before we sleep, and miles to go before we sleep." Thank you all. Helge.
Thank you very much. I will not try to sum up the messages we have heard today, but just reflect on some of my own thoughts following the seminar from my own computer at the back of the room where I'm staying now. First of all, I'm a member of the Habitat Board, Habitat Norway Board. I'm a land surveyor. I've been working with restoring private ownership in former socialist countries in Europe for the last 20 years. So I have some insight into that, into the tenure issue, into the housing issue, but know little or nothing about the health issue. I think Jan Egeland at the very end summed up the seminar in a very good way, and also pointed in a good way the way forward, what could be done. It's not, and then we have to distinguish certainly between short-term interventions and longer-term interventions. Many of the things he mentioned about better urban planning, better housing, etc., is not something that can be resolved in the time frame of this pandemic. However, when it comes to the pandemic, the coronavirus, the COVID-19 pandemic, I don't know if we are in the beginning or in the end of the beginning or in the beginning of the end. It certainly could last for many years still. Even if we have a vaccine next year, it could last for a long time. So it's very relevant to look at short-term interventions that could help. One example from Norway, for example, when we started with the outbreak, my government has been extremely clever with dealing with COVID-19. We have very few deaf people. At the beginning, we had an issue with the Somali community in the part of Oslo, where the outbreak was more intense than in other parts of the city. And they learned very quickly that we need to involve the local people. We need to talk to them in their own language. And that very quickly helped with the situation. Just one small example that it helps to involve the local people. As Jan said at the very end, whatever we should do, we should communicate with the local people. In many cases, the local people are the best experts. So whether we are talking about short-term interventions or we are looking at housing or tenure issues in a much longer perspective. And there are things that can be done even if it take long time. Very scaring. Another message from Jan Egeland, that the richest countries are concentrating their funds to resolve now the issue to themselves. I don't know if you have any reason to believe that the richest countries would share their money with the poorest country to resolve the issue, or even will share the vaccine that might come. It will be exciting to see if there are some mechanisms in place for that, but it will be exciting to see if it really happens. This has been the most appropriate way of celebrating the Habitat Day, best way we in our small association could do. I think and we will certainly continue. Housing and urban planning are the two key issues we are working with. Hopefully, the pandemic issue has visualized some of the problems and challenges which are there and which has been there for a long time. When it comes to the way forward for ourselves, we will certainly continue to work with these issues. I will congratulate UN Habitat for preparing their report, their flagships report, so quickly. I will encourage other international organizations to raise the awareness and work more with urban issues. I learned today that 56% of the world population live in urban areas, and only 4% of international aid is channeled to urban issues. So there's a big gap in terms of where people are living, their problems, and how international, bilateral, and international aid is channeled to people. Finally, I've been sitting in the back of this room watching the web seminar, and it has worked remarkably well. We have had only very small problems with the noise, thanks also to the organizer here, the Polytechnic Association in Norway, which has been hosting the event in a way and taking care of the technicalities. It illustrates very well that's possible to arrange international seminars without coming together in one big room. That is also a contribution to achieving the Sustainable Development Goals. I wish you all a happy day to continue thinking about what you and your organizations could do to the world, to the poor in the world, to the poor urban dwellers as they are struggling with the COVID-19 disease. Thank you.